Dear colleagues, in this video we are going to talk about the complications of the Port Delivery System implant or PDS. Let's get started. The first complication is conjunctival retraction, which is recession of the conjunctiva in the area of previous peritomy with or without implant flange exposure. Potential cause of conjunctival retraction include inadequate limbo suturing or excess tension on the primary closure from inadequate dissection. Also, suturing too close to the implant or excessive traction to the adjacent conjunctiva may also cause conjunctival retraction. Recommended management approaches depend on the degree of the retraction and may include topical antibiotics with observation or surgical repair. Conjunctival erosion may be defined as a full thickness degradation of the conjunctiva and tenous capsule in the area of the implant flange. Potential causes of conjunctival erosion include wrong suturing, mechanical stress to the conjunctiva, excessive tension of the conjunctiva and tenon, and implant flange that does not rest flat against sclera. Also, rubbing or inflammation may cause conjunctival erosion. Recommended management are conservative with eye drops and follow-up for small erosions. If they are large, conjunctival flap or reposition of the conj should be pursued. Endophthalmitis has been observed during treatment with PDS implant. This dangerous complication demands immediate treatment. Possible causes of endophthalmitis are a breach in the sterility during PDS implant insertion or refill, or implant exposure secondary to conjunctival retraction or erosion, or the presence of a leak. Management may follow usual other types of endophthalmitis. Implant dislocation, either external or to the vitreous cavity, concerns a PDS implant that has moved location. Possible cause into the vitreous cavity include excessive force applied to the implant during refill exchange, larger than recommended scleral wound, ocular trauma, or eye rubbing. Recommended management for implant dislocation may be for dislocation outside the vitreous cavity, prompt surgical intervention is recommended. For dislocation into the vitreous cavity, surgery is advised most of the times, although timing will depend on associated factors and depth. The PDS implant and implant insertion procedure has been associated with conjunctival bleb, which is an encapsulated elevation of the conj above the implant. Other complication is the wound leak, which may be associated with hypotony or choroidal detachment. If leak is small, conservative treatment may be chosen. If refractory, revision of the implant with additional sutures may be chosen. Choroidal detachments may be treated with topical atropine and systemic and intraopical steroids, or ultimately with drainage. Implant insertion procedure of the implant has been associated with vitreous hemorrhage due to intraocular bleeding from the pars plana or ciliary body in the region of the scleral incision. Implant location should be considered in the decision of the management. either conservative or removal of the blood. Retinal detachment may occur with PDS implant. Management is surgery and technique may be at surgeon's discretion. And lastly, cataract. Their formation or progression were observed in the PDS trials. Surgery may be performed with usual techniques, with special attention to a clear cornea incision. In summary, we reviewed the 8 complications associated with the PDS implant. I hope you enjoyed the video. See you next time.